Hi, welcome to the channel. I'm Roxy B, your principal educator here at the Nursing Code Lab. I have some questions for you. Have you failed the NCLEX more than once? Are you doing a lot of practice questions but still getting the majority of them wrong? What about prioritization and delegation questions? How are you doing with those? Are they throwing you off? Today, I've started a series and I'm going to be breaking down the number one reason why you may not be getting above passing standard on the exam. I'm going to be introducing to you a decision-making strategy that will help you to filter through the NCLEX answers, just like a nurse would, even if they didn't know all the content of that particular topic. Now, most nursing students and internationally educated nurses believe they failed the NCLEX because they didn't study enough. And this might be true for some, but the next step usually is they would go back and rewatch videos, reread notes, and try to cram more content. But I have a question for you. Do you think that the real reason you failed was because you needed more content? Or was it because you didn't have a decision-making system? Because knowing the information is one thing, and choosing the best answer is another. And the NCLEX does not just test your knowledge, it tests your clinical judgment. It's about how you're thinking through the questions and making decisions. So you will be presented with 4 to 6 options depending on the type of questions, and they all look correct, but they want to see how you actually prioritize them. So without a method to sort through the options that you are presented with, you're going to continue to guess and not feel confident about your answers. Some common mistakes that you might be making right now as a repeat test taker is that you are probably second guessing your answers, you're probably picking familiar sounding answers, or maybe even thinking everything is important and not recognizing the urgent ones, or maybe even relying on content only and not developing a strategy, right? So the NCLEX exam requires you to demonstrate the ability to use clinical judgment to provide safe patient care. So basically, do you recognize what you need to act upon? Do you recognize or know what to delegate or when to reassess? And that's what separates a pass from a fail. So you don't need to know everything, you just need to know what to do first. So in this series, I'm going to teach you a decision-making strategy I created for repeat test takers. But first-timers, you will benefit from this as well. It's called the Traffic Triage Map, so TTM for short. It guides you to determine what the NCLEX is asking you to do, as well as helping you to pick the correct answer. So it may ask you to go into the red zone, where they expect you to choose an answer that requires you to act now to save a life. Or they may ask you to go into the yellow zone, where they want you to watch closely because the patient could get worse. Or maybe even the green zone, where the patient is stable, or maybe a task could be delayed or delegated. It is a strategy you can apply even when you don't know all of the content. All right, so let's do this sample question. So a client was admitted to the hospital 24 hours ago after sustaining blunt chest trauma. Which is the earliest clinical manifestation of acute respiratory distress syndrome the nurse would monitor for? So let's break down this knowledge-based question that still needs strategic thinking. So we see that this is a clinical judgment and early recognition question. So we're not just choosing a fact, you're deciding what would show up first. What would you need to monitor for? Now your options are 1, cyanosis with accompanying pallor, 2, diffuse crackles or rhonchi on chest auscultation, 3, increase in respiratory rate from 18 to 30 breaths per minute, or 4, diffuse haziness or whiteout appearance of lungs on chest radiography. So we're looking for the earliest clinical manifestation of ARDS and something we have to monitor for. So when we apply the TTM strategy, this is a yellow versus red judgment call. So not all answers are equally urgent in this situation or in this scenario. So we're going to go through our options here and label each one of them with either red, yellow, or green. So number 1, cyanosis with accompanying pallor. So this is a late sign of hypoxia, right? It's dangerous, but not the earliest signs of ARDS. If we are already seeing cyanosis on our patient, it's because it's progressed already. So I'm going to give this a red zone designation and cross it off. Now we want to look at option 2. So diffuse crackles and rhonchi on chest auscultation. So audible sounds of fluid or even a collapsed lung may occur later in ARDS. And it is important, but not usually the first sign that we would see. And yes, it could warrant a follow-up, but it's usually not the earliest cue. So I'm going to give it a G as a green zone designation. So I can cross that off as well. 3 is increase in respiratory rate from 18 to 30 breaths per minute. So when we talk about tachypnea is usually a subtle but critical sign that something is not right from a respiratory perspective with our patient, and it shouldn't be ignored, right? And the NCLEX loves early warning signs. So a change in respiratory rate is definitely one of those first, right? It's not flashy, it's not dramatic, but it's usually there. So I would give this a yellow because if we don't address it, and if we continue to ignore it, it can lead to a red, okay? Can turn into a red zone if it's missed. Then we're looking at the diffuse haziness or whiteout appearance of the lungs on the chest radiography. So automatically here, I know that this is a diagnostic confirmation. It's not a clinical manifestation, and it's not a symptom, right, that the nurse would be monitoring for. So we don't need to actually include this one. This is really a distractor. And if we actually see haziness or whiteout on our patient's lungs, it's because they are already compromised, okay? So I'm going to cross out number 4. So my only option here, and this is going to be a green actually, number 4, and my only option here is now option 3, okay? So let's use the TTM to think like a nurse, not just remember facts. So here, for the red zone, cyanosis feels urgent, but it's too late. Yellow zone, it's the earliest sign because we're monitoring for something. We're watching closely so that it doesn't turn into a red. And so a sudden jump in the respiratory rate, this is a yellow flag, and if ignored, can lead to red. Then we have the crackles and rhonchi, and imaging shows progression, not onset, okay? And so that's what the TTM or the Traffic Triage Map helps you to do, okay? So in the next video, I'm going to teach you how to spot the red zone answers, the ones that should instantly jump out at you in a priority question. Even though everything looks important, the red will still jump out. If you can recognize red, you can get more questions right without second guessing. So If you're ready to think like a nurse, not just study like one, then you're definitely in the right place. So if you haven't already done so, please subscribe and like and turn on your notifications so you don't miss the next video that I'm going to download within the series. And we would also love to hear what struggles you have been experiencing as you've been preparing for the NCLEX, like to retake the exam, right? So comment below so it can help us also to create content just for you and others in your situation. Now, in preparation for the next video, if you like, you can also download and access the Red Zone checklist, which will provide you with some symptoms, labs, and key phrases that usually mean that you need to act now in order to save a life. So I look forward to seeing you in the next video and have a great day.